Effectiveness of TMS in drug-resistant major depression by Olaide Akinyinka, University of Texas, Rio Grande Valley, July 4th, 2018. Description of the problem. Major depressive disorder is a disease or disorder that affects a lot of individuals around the world. Researchers believe it is affecting over 300 million people around the globe, and it's estimated that by 2020, depression may be the leading cause of disability around the world if care is not taken. World Health Organization 2018. Each year in America, over 30,000 individuals die from committing suicide. A majority of the victims suffer silently from major depression, according to World Health Organization in 2018. Most providers believe antidepressants do not work for everybody, and individuals are very different when it comes to responding to medications. There are so many factors that come to play. Proposed practice change. According to the journal published by Journal of the American Medical Association, it was discovered that about 4.5 million people in America with depression do not respond in full to antidepressants. The good news is that there are many other treatment alternatives out there that can be part of the treatment plan when it comes to depression. One of the alternatives is transcranial magnetic stimulation, called TMS. This has been proven to be effective and can be discussed as part of the treatment plan from the beginning. What is transcranial magnetic stimulation? It is a non-medicinal, non-invasive therapy that makes use of magnetic pulses to stimulate particular phases in the brain that may be underactive in depression. Such areas include the prefrontal cortex, which is the major area being treated with TMS in most patients. During the procedure, the individual will be awake and they can easily get back to their daily activities like work or driving right after the session. How does TMS work? In the first therapy session, the provider will examine and keep track of the patient's motor threshold, the amount of magnetic pulses and strength that will be delivered during each course of therapy session will be customized for the individual. During therapy, an electromagnetic coil will be placed on the individual's scalp and around the forehead. The magnetic coil is not painful, and it will deliver magnetic pulses that will stimulate the nerve cells in areas of the brain that controls mood and depressive feelings. The session in most cases involve 5 days a week for up to 6 weeks, and a period of taper to gradually reduce the treatment sessions according to patient's response. Presentation of the evidence. TMS is recommended for individuals with major depression that have failed to respond to at least one or more antidepressants. Multiple studies support the effectiveness of TMS for depression. A randomized controlled trial of 199 patients concluded that TMS produced symptoms remission after 6 weeks when compared to a sham procedure. This is according to Judge et al. 2010. An open-label study was done with neurostaff, which resulted that about 58% of the individuals studied significantly responded positively to the therapy. About 37% achieved total remission of their depressive episodes and symptoms, according to Carpenter et al. 2012. Presentation of the evidence. According to Levkowitz et al. In 2015, this article involves a double-blind double-blind randomized control multi-center study evaluating the effectiveness and safety of deep TMS in major depression in patients who had failed 1 to 4 antidepressant trials or not tolerated at least 2 antidepressant treatments at that moment. The evidence demonstrated TMS therapy to be effective in patients that received the therapy. Significant improvement up to 16 weeks, and significant improvement was seen in patients with higher resistance to medications. Recommendations by researchers. According to George, Taylor, and Short, 2013, they indicated that the neurologists believe that stimulating brain will only be successful when it induces seizure, such as in ECT, electromagnetic therapy, electroconvulsive therapy, but also concluded that gentle and repetitive currents generated by TMS can be effective when delivered in session repeatedly over several weeks. Several small changes can also add up, and repeated exercises can build a stronger muscle. Just like in TMS, the treatment can be effective over a period of time. Recommendations in practice. Patients respond to treatment differently. There have been some positive responses in most patients, especially in the first few weeks. In clinical settings, I have witnessed the effectiveness of TMS similar to the clinical trial results. On average, about 65 to 70% respond to treatment, and the rest are in remission of their symptoms in most cases. Personally, I have seen patients that are taking up to 9 antidepressants experience a decline in depressive episodes in less than 5 weeks, and even better response with patients with fewer antidepressants. Implications for practice. TMS is very promising in clinical settings and show improvements in patients, but it is not a miracle. Many patients have experienced remission and able to prevent relapse. Some NIH-sponsored clinical trials concluded that about 2 of 10 patients achieve remission following TMS. This is a great deal and should be explored in clinical settings. The treatment is still not covered by most insurance, and paying out of pocket could be very challenging. So many patients receiving TMS now have options when their medications are not working. They can continue taking the medication while receiving TMS sessions, or in some cases, they may stop taking the medication to see the effectiveness of the TMS. In conclusion, depression is one of the major mental health disorders affecting so many individuals in our society. Most patients rely on several medications to get therapeutic dose, and in turn, they develop resistance. TMS is an alternative that should be explored when in this situation before going for electroconvulsive therapy. I have personally experienced with patients that are receiving TMS with positive responses and increase in compliance. Thank you.